Hi everyone, I'm Joe Calderoni, Senior VP for Communications here at Mount Sinai, South Nassau. This is another in our series of Facebook Live events designed to keep you informed about what's happening at the hospital during this pandemic. Very glad today to have the chair of our emergency department with us, Dr. Josh Kugler. Dr. Kugler has been on the very front lines of the pandemic since day one, along with him and his emergency department team of nurses and other specialists. We're just going to move out of the way of this ambulance for a bit so they can pull in. We're obviously outside the emergency department today, and the purpose of this is to let you know that our emergency department is open and ready for business, and also ready to serve you for non-COVID related medical needs. So let me just turn to Dr. Kugler. Let's start with the good news. We have far fewer COVID patients now. I believe we're under 50 inside the hospital than we did just last week or the week before, and we've actually been converting most of our operations to non-COVID related more normal operations. So just walk us through what's happening inside the emergency department today in terms of COVID versus non-COVID.
Sure, thanks Joe, and thanks for having me on Facebook Live. It's important to get the message out to our communities, and as you alluded to, we're in a very different situation than we were 4 weeks ago, certainly very different than 6 or 8 weeks ago when we were sort of at the peak of our COVID crisis and pandemic. So first and foremost, I really want to reach out and thank the community. They cannot have done enough for us, keeping us standing up by supporting us, first and foremost by quarantining, staying home, social distancing, flattening the curve. You've heard it. They did it, and that was
really did make a difference. I mean,
huge difference, and that's the reason why we were able to take care of so many patients here at Mount Sinai, South Nassau in such an effective way. In-house today, we have 50 patients.
50 COVID.
Total COVID patients, 50, which is a small number compared to what we had at our peak, where we were managing over 100 intensive care COVID patients, and several hundred, 400+ patients who had COVID who were non-intensive care, an amazing number of patients.
So I believe overall we treated 1,200 COVID patients approximately during the course of the last couple of months.
That is correct. We had an amazing number here in Nassau County. As you know, Long Island was very hard hit. As right. Well as Manhattan. And I have colleagues at very rich academic medical centers in Boston, in North Carolina, and they were not hit like we were, so they were learning from us.
Right. So again, if I'm home, and we've heard this anecdotally, and we know that our emergency department volume is way down from what it was pre-COVID, and you've heard anecdotally from patients and physicians that some people are staying home even when they have serious symptoms because they're fearful still of COVID. And that obviously can be more problematic, much more problematic than if they came here to seek treatment. I mean, we've heard of people with chest pains, with numbness in an extremity, sure. And they're not coming forward. So just talk about the dangers of that and what people should do.
Absolutely. Thanks for bringing that up. So the most important thing that people should know is not to put their health on hold. That Mount Sinai South Nassau is here to treat all kinds of medical ailments, every emergency you can think of. We have too many cases of patients staying at home and out of fear and not coming to seek care for chest pain that was an underlying heart attack. And in fact, those patients are going to suffer long-term consequences from not getting and receiving the proper care. Long-term heart failure, they'll be on long-term medication management, some of whom have been compromised by and even died because they put their health on hold. We absolutely do not want patients to put their health on hold. If you're having any kind of emergency, please call 911, activate the emergency medical system, be brought to the hospital. You will be very well cared for in a compassionate, patient-centric way like we always have here at Mount Sinai South Nassau. We do not want to see anyone have a stroke at home and leave it at home where it then falls outside of an appropriate treatment window. Obviously, time is of the essence when it comes to emergency care like heart attack and stroke. So again, I want to emphasize to the public, do not put your health care on hold.
All right. So I'm kind of a skeptical guy by nature and by training. I used to be a journalist. You say it's safe to come here, but what are some of the specific procedures that take place inside to make sure that infection control is in place, and that if I'm not a COVID positive patient, that I'm not going to get COVID when I come here?
A fair question. So the only thing that's different is what you see, and that's really the masks that we're dealing with, the PPE, the personal protective equipment. Everybody inside the department is still maintaining a high level of vigilance, and we're using PPE. And the reason for that is to protect everybody, to protect the staff, to protect every patient until we understand what has brought them into the emergency room. And that goes in all of healthcare. So we're utilizing the PPE, and that's really the only difference in how we're operating now, and we're putting patients and sorting patients appropriately. You'll see as we walk in today, we have a forward triage person. They're going to ask specific questions to infectious disease. If in fact you answer positive to any of those questions, you'll then be put into a place specialized to treat infectious disease. If you answer negative, we'll put you into a place that you would normally be placed in an emergency room when we're not having a pandemic like COVID-19.
Now, when we spoke earlier before we went on the air, you mentioned that essentially we're treating everyone. We're assuming that everyone is positive until we can figure out that they might not be.
Absolutely. Best practice is really, this is a difficult diagnosis to make now, more than it was 6 or 8 weeks ago when we were at a peak. We flattened this curve so much that we're actually seeing less and less of it in the patient population, the prevalence, as you stated. So while the prevalence is down, there are still cases there. So we have to be a little bit better at our forensics at teasing out those cases. And as you know, about 40% of the population can get COVID and be asymptomatic. So you may actually have just broken your arm, and that's an emergency. But you don't realize that you may have COVID as well. We do not want you to infect somebody who may have an underlying medical illness or may be immunocompromised. So we want to protect you from other patients, and we want to protect our staff, and just be cognizant of the fact that COVID is still in the community.
Now, you mentioned also inside the emergency department, if we do identify someone who comes to the emergency department and is COVID positive or has symptoms that we think might mean that they're COVID positive, we have isolation rooms inside that we would utilize. Tell us about that.
Absolutely. We've learned a lot through this COVID-19 pandemic, and one of the things that we learned, and it helped us change our operations, was to be better prepared with airflow, proper airflow, not just negative pressure rooms for emerging infectious disease, but fresh airflow. So the hospital engineering department did an amazing job at re-engineering all the airflow throughout the entire organization, not just the emergency room. But we have fresh air going in and fresh air coming out.
As opposed to recirculated air, which is what we normally would do for heat and cold.
Absolutely. So we're much more sophisticated at handling airflow than we were, and that is in play today. So it's one less thing we have to think about. We know we have good fresh air coming in, and that's going to help keep our infectious disease spread down.
And if we do place you in an isolation room, that has special ventilation, negative pressure. What does that mean?
So negative pressure is really a way of drawing air into the room, so whatever is inside the room being aerosolized, potentially a cough or a sneeze, is not moving outside the room. It's not infecting anybody in and around the area of that room. So that patient has that air, has their own airflow. Okay. Air is being drawn in. That's the negative pressure. It's being sucked into the room and then being discharged out in a safe, effective manner.
Right. So this is one way that we keep patients safe from the rest of the patient population.
Patients and staff. Again, we want to keep our staff healthy so we can serve our patients.
Okay. So I'm getting the almost running out of time message from my crew, which, by the way, has been terrific during this entire crisis. And we're going to show our Facebook audience, if you arrive at our emergency department here in Oceanside at Mount Sinai, South Nassau, what you're going to encounter, what it's like as you walk in.
Okay, great. So as we come here, you've already had a précis to the EMS entrance. They just made a grand entrance, and that was not,
That's how the ambulances
I didn't call them and tell them to come. They just came. It's very spontaneous.
Right.
During the crisis, we had ambulances as far as you could see to Oceanside Road, about 15, 20 at a time. So having 2 or 3 is actually quite good. This is our triage vestibule. There's a sign out front in multi-languages telling people to hand sanitize. It's telling people what they need to do, to grab a mask. It's obviously preparing the patients to come into the ER to be screened. Our waiting room, we try to keep our waiting room empty. A waiting room, in our estimation, is not for patients. It's for patients, potentially loved ones. Patients belong in the emergency room for care. And what you see behind us, I'm going to lower my voice just a bit. What we see behind us is a patient who is actually getting screened in for care here in our emergency room. We have a forward triage nurse. We've kept our triage nurse out in front so they can ask the appropriate questions, as we talked about, to make sure that the person...
And what would those questions be at the
Yeah.
triage center?
Very simple. We ask, are you having a fever? Are you having an illness? Tell us about your illness. A cough, chills. Have you been exposed to anybody who's been recently ill? And anything else that may be germane or important to glean up front to help put you in the appropriate locale.
Okay.
So
that's part of our screening process up front. So you're not just walking in the door anymore. You're being stopped. You're being questioned.
Absolutely.
So that we can keep everyone straight and put them in the right place. All right, because we have patients in the waiting room, we're going to actually go through the ambulance entrance.
Perfect.
And go into the inside.
Multiple ways in.
Okay.
Like to keep it that way.
All right. Here we go. So this is our ambulance bay. As you said, this was backed up, but now, as you can see, it's more back to normal.
Yep.
For sure.
This feels good to me. I know it could be shocking for our audience to see ambulances coming in. It seems like they came all of a sudden. But this is normal operations. You know, on a normal day, we'll see 60-plus ambulances here. So you're talking every 3 an hour.
Right,
so
right.
During the busiest times, we see 4, 5, 6, or 7.
You mentioned. You're going to let us in here?
Yeah. So we're gonna move into our annex, which is a wonderful unit that we've been able to utilize as a swing unit. The one benefit of this annex.
We were going to mention that. So as the ambulances come. Well, let's walk down here 1 second.
Yeah, so the ambulances come in this manner. They'll come up this ramp, and they enter. They all have access. We can see them through cameras. We can question them if we need to. We can speak to them on the phone prior to coming in. There are many things we can leverage.
There are some patients there.
It's okay. There's no patients that you can see.
Okay,
you can see the
right.
EMS agencies
Right.
there.
Good, good.
And they would line up, and we've moved our ambulance triage folks up forward as well, so we can receive them more effectively and more efficiently.
So they're also being questioned.
They're getting the same level of questioning that the screener is up front.
So
for
whether
the
you
patients coming
come by car on your own or whether you come via ambulance through the 911 system, you're still being screened either way.
and you're being screened in a forward manner, meaning we've moved our screening forward so we keep potentially infectious people out of the ER until they're properly sorted.
Okay, good. Let's go into the annex now. I'm glad that we made that stop.
Okay. And you got to see some ambulances queuing
There
up.
we
With
go.
it. That's going to be cleared in about a
Right.
minute. It really doesn't take very much
Now,
time.
you mentioned to me earlier we have about 40 patients today.
Yeah, so inside the department now, there's about 40 active emergency patients, which is below our normal daily census. As you know, ERs have had a depressed census due to the fear of getting COVID from our
Normally
patient
we might
population.
have 60 or more patients.
So that's our typical volume would be 60. Again, if I can, just for a moment, to highlight this beautiful area that you're coming into, it's just been terminally cleaned. It's actually magnificent. This is called our annex, and this was a very highly utilized area during the COVID pandemic. Every room
let's walk down and so they can see one of the...
packed. This is actually where we held our COVID patients or our patients under investigation until we determined whether they were COVID positive. And
Come on back. I want them to see one of the areas. One of the
and we did
great
amazing
patient
care in
areas.
here. So it's a beautiful area. It's been cleaned. That's why the floors are sparkling. Everything's been very much deep cleaned. And
So
this
when
area has special air
when you
handling.
say terminally cleaned or deep cleaned, there are specific EPA disinfectants that are used specific to the virus, so that we make sure that this place is really spotless before we let
Absolutely.
any non-COVID patients in.
And this is time for a shout out to our environmental services group, because they have done a Herculean job throughout the entire institution. You know, my world is back in the emergency room, and I tend to be very focused on the emergency room, but they have been nonstop cleaning, and they're not afraid of anything. So they come in right behind a trauma, they come in right behind an infectious disease, and they come in well prepared to terminally clean everything. So as you can see, the place is spotless. It's been steam cleaned and cleaned with specialized appropriate chemicals for a hospital to make sure that all viruses and all bacteria and all funguses have been eradicated in these areas.
They are the unsung heroes of this crisis, no
Certainly
question.
one of them. They're
Along
amazing.
with our doctors and nurses, without whom we wouldn't have a hospital. Here's another question from our Facebook audience. Thank you for sending these in. Keep them coming while we have Dr. Kugler with us. Is antibody testing accurate? I know that we're offering antibody testing at 10 sites now across the South Shore at all of our ambulatory sites, and you can go on our website, MountSinaiSouthNassau.org. Do I have that right, guys? And there will be a list of all the 10 sites along the South Shore where you can go for antibody testing.
So
but is it accurate?
So
yeah.
Accuracy, absolutely. So, antibody testing, there's two types of antibody testing. A qualitative test, do you have antibodies, yes or no? And a quantitative test. How much, if the answer is yes, how many antibodies do you have?
That's the titer, the
That is the
so-called
titer. Very
right?
good, yeah.
Okay.
So everyone's become so knowledgeable about this infectious disease. But the antibody tests themselves are quite good. They've gotten better over time. Their accuracy is quite good. And we're learning what it means when you have antibodies. The one question that hasn't been answered is, when you have antibodies, we believe that protects you from ever getting COVID-19 again. But we're not 100% sure about what it really means to the population. I believe, and I think the Infectious Disease Society of America believes, that it does confer immunity to future COVID illness.
So that's something that we do need more study on, but that's based on what's happened with other viruses and antibodies and vaccines.
Absolutely.
Okay, very good. And I believe the antibody test we're using was developed by Mount Sinai Health System.
So
right?
we're very fortunate. We have a robust academic medical center associated with Mount Sinai, and that helps us get testing a little earlier. And yes, we're doing testing directly through those labs and affiliations.
Yeah, I mean, the system has been incredibly supportive throughout this entire crisis in terms of providing PPE and their expertise, and even beds, just the physical beds.
Yeah, it's been great teamwork.
Yes, yes. Okay, so what about kids who are coming to the emergency department, pediatric patients?
So our pediatric patients in the ED, and we had some coming in, I think, during this interview, and I will tell you that they're seen in a specialized area. We still have our pediatricians in our ED who treat the lower acuity pediatric patients, and they're here as well. So we haven't given up on our staffing. And we're happy to see all comers for pediatric care.
And our pediatric unit also has been converted back, I believe, to non-COVID, to its normal pediatric
That's
purpose.
right. Very good. So during the crisis and the peak, we were not seeing pediatric kids. As you know, they were relatively spared from the COVID-19, which is a wonderful thing.
Thankfully.
And yes, thankfully. And now our pediatric unit is up and running as a PEDS unit. And again, operations as usual, with some exceptions, right? Where some more and maintaining vigilance. Again, I just want to tell everybody that while we're operating and we want to see all of our patients, we also want them to understand that we're not clear of COVID-19 yet. So everyone should still maintain good hand hygiene, good face hygiene, social distancing when appropriate. I know things are opening up, and we're in phase 1 now of our reopening. But again, good vigilance, and I think people are pretty
We're
mindful.
not quite 6 feet apart, but as you pointed out, we have masks on.
We have masks,
we're
and
not touching.
and as colleagues, we're in the same environment during the daytime, and as long as we're using our good hand hygiene and good face hygiene, we're going to be just fine.
All right, very good. So we're going to wrap up. Just to sum up, for folks who are at home, maybe they're experiencing some kind of a symptom, what advice are you giving them?
Please do not hold off on your health care. Call 911 if you're having a medical emergency. Activate the EMS system. Come to the emergency room if you feel like you're having an emergency. Do not hold off on your health care. Chest pain, shortness of breath, numbness, tingling, anything that you think is abnormal and thinks necessitates an emergency visit, do not hold off. Please
Better safe than sorry.
Absolutely. If nothing's wrong, we'll treat and get you back home to your loved ones as quickly as possible.
Excellent. Very good. Thank you, Dr. Kugler. As always, terrific information. Thank you to our Facebook audience.